Έρχεσαι κι εσύ πρωί και βράδυ, σαν μικρή δροσοσταλιά. Ήρθες μια βραδιά με τον αγέρα, αναστέναξει η καρδιά. Σου πάμε λαχτάρα καλησπέρα και μου είπες έχε γεια. Μίλησέ μου, δεν σε φίλησα ποτέ μου. Μίλησέ μου, πώς να σε ξεχάσω Θεέ μου. Μίλησέ μου, δεν σε φίλησα ποτέ μου. Μίλησέ μου, μόνο στον όνειρο μου σε φιλώ. Φύτεψα στην πόρτα σου χορτάρι, να έχεις ίσκιο και δροσιά. Κι ήρθα πριν αλλάξει το φεγγάρι, να σου φέρω ζεστασιά. Σε βάλα στου ήλιου τα νηφόρη, στα σοκάκια τα πλάτια. Μα ήρθε παγωνιά και ξεροχώρη και δεν μ' άναψες φωτιά. Μίλησέ μου, δεν σε φίλησα ποτέ μου. Μίλησέ μου, πώς να σε ξεχάσω Θεέ μου. Μίλησέ μου, δεν σε φίλησα ποτέ μου. Μίλησέ μου, μόνο στον όνειρο μου σε φιλώ.
This song is composed by Manos Hadzidakis. This song we sang, and now we are going to sing a song which is composed by Mikis Theodorakis.
Ένα το χελιδόνι κι ανοιξιά ακριβή, για να γυρίσει ο ήλιος θέλει δουλειά πολύ. Θέλει νεκροί χιλιάδες να είναι στους τροχούς. Θέλει κι ζωντανοί να δίνουν το αίμα τους. Θέλει κι ζωντανοί να δίνουν το αίμα τους. Θεέ μου πρώτο μάστορα, με χτίσες μέσα στα βουνά. Θεέ μου πρώτο μάστορα, με χτίσες μες στη θάλασσα. Πάρθηκε απ' τους μάγους στο σώμα του μαγιού, το έχουνε θάψει σε ένα νήμα του πέλαγου. Σε ένα βαθύ πηγάδι το έχουνε κλειστό. Μύρισε το σκοτάδι κι όλοι αβυσσό. Μύρισε το σκοτάδι κι όλοι αβυσσό. δάσκαγες κι εσύ, δε μου πρώτο μάχας τώρα, μυρίσες την Ανάσταση.
That was from us.
Thank you very much. So that is live from Athens. We have Theonas Karatsis and Alexander Tudor performing live for us, and you will hear more from them later on in this webinar. Welcome to the EUCOMS webinar. EUCOMS is the network of community mental health services across Europe and also way beyond Europe. And we learn from each other practices. So we go to different countries, and this evening we will go to Greece. And the host of this evening is the wonderful Society of Social Psychiatry. So my name is René Kiet. I'm the chair of EUCOMS, but I immediately hand over to the chair of this evening, and that is Sakellaropoulos. Eleftheria.
Good evening to everybody. I'm really happy EUCOMS gives us this opportunity to share with you our experience from community psychiatry in Greece. I would like to let the president of the Society of Social Psychiatry, Panagiotis Sakellaropoulos, Mrs. Athina Fragouli, welcome you and say a few words, and we'll be back again. Mrs. Athina Fragouli.
Thank you, Eleftheria. Thank you, René, for the opportunity that we have today to share our experience of offering the services in the community in 4 areas of Greece, 40 years now. And we will be happy to welcome you in Greece whenever it is planned. Thank you.
Okay, so we have prepared 3 presentations for today. And then we're gonna listen to some live music from Theonas and Alexandros, and you'll have the opportunity to ask anything you want or to comment on our work. I would like just to remind everybody, because I don't want to forget about it, that after the presentations and the musical interval, you will be able to use the Q&A button to ask anything you want, writing also who you are and from where you join us. You join this webinar, and if anybody wants to participate live, it's okay during this part. So I will begin presenting you our services in the 4 areas of Greece. Give me a moment, please. No.
Can we help you, Eleftheria?
Is it okay? Can everybody see the PowerPoint full screen?
Yes, it's there. Yeah.
Okay. So the title of the first presentation is the Community-Based Mental Health Services of the Society of Social Psychiatry Panagiotis Sakellaropoulos across 4 regions in Greece. Just a few words about our profile and activities. We are a non-profit scientific organization established in 1986 by Professor of Psychiatry and Child Psychiatry Panagiotis Sakellaropoulos and his associates. Our organization offers high-quality psychiatric services as part of the National Plan for Mental Health Program Psychargos of the Ministry of Health. It promotes Greece's psychiatric reform based on the methodology and the principles of social community psychiatry, the psychoanalytic prism, and action research. These are the three basic parts of the way we work. We support a wide network of mental health services, which include services for the prevention, the intervention, the therapy and rehabilitation of mild or severe psychiatric disorders. We have programs for the social and employment inclusion of people with psychosocial problems, sensitization and awareness raising activities regarding mental health issues. We call it community sensitization. We also have educational training programs for students, postgraduate students or mental health professionals, and also for the users. And also we run activities and programs in cooperation with mental health networks in Greece and in Europe. Our vision is to try to work systematically for everyone so that everyone has access to free quality mental health services and to be able to attain the highest possible level of mental health and well-being in an open society. Our mission is to serve people who need us. At the same time, we work with the population in order to establish the request for help. Our basic values are high-quality mental health services accessible to everyone, equality and respect of human rights, solidarity towards every vulnerable group, and also transparency, accountability, ethics, trust in our relationships between us, with our associates, with the users of our services. I'll try to give a rough idea of how the organization works. The numbers I'm referring to are about last year, 2022. You can see in general that we have services in nearly 5 prefectures of in Greece. That's because Evros and Rhodope are close to another. So it's Attica, where Athens is, the capital of Greece, Phokida, Phthiotida, Evros and Rhodope. I have a map I'll show you later. We have 35 mental health units, 200 people and 42 employees. Last year, 39 students did their internships with us. We also had 35 volunteers last year. And we counted 3,435 mental health service users who had the opportunity to have from us 62,525 therapeutic activities in total. I'm going to explain later analytically what this number refers to. So here is a map of our country. You can see here is Phokida, which is a mountainous area in Greece. Here is Evros and Rhodope, which is also a very big region in the borders with Turkey. Here is Athens and Attiki, and the region of Phthiotida. Maybe I should mention that above Phthiotida, there is this, how do I go back? This region of North Evia, because one of my colleagues is going to talk to you about very recent actions we took here in relation to big bushfires we had. So who we work with? We work with children in every developmental stage, with adolescents, and with adults, from the simplest symptom to the most severe and complex mental health disorders. We work with vulnerable social groups, that is, homeless people, refugees, grants, and with local communities when they face periods of crisis. We work with every citizen and professional group as far as sensitization and prevention activities is concerned, crisis management, and right advocacy and protection. A big part of our work is about mobile mental health units. One of my colleagues, Ms. Siliana Lazoyorgu, is going to talk to you a lot about this model of work. So I'm just going to say a few words. We have two mental health units, one in the prefecture of Phokida and one in the prefecture of Evros Rhodopi. This model has to do with working from an interdisciplinary team that consists of psychiatrists, psychologists, social workers, speech therapists, and nurse that go to distant areas to reach people that are in need on specific days a week. I'm not going to say a lot. We can just see some numbers of people that were beneficiaries of this model last year, and my colleague will tell you a lot about this later. We also have a lot of psychosocial rehabilitation units. These are protected living spaces of high, medium, or low support for adult persons with psychiatric disorders and psychosocial difficulties. And their operation is both therapeutic and rehabilitative. We have 29 psychosocial rehabilitation units. Some of them are hostels, 6 of them are hostels, and 23 are apartments. 177 people live there. These are placed in Athens, in Alexandroupolis, which is the capital of Evros, in Amphissa, which is the capital of Phokida, and Lamia, which is the capital of Theotida, the regions we have our premises in. The basic aims of their operation include quality of life with a personal meaning for the residents, holistic mental health care, empowerment in all aspects of health, active inclusion in the operation of the unit and its organization, and social integration. You can have a quick look at some pictures from living in the residential units. We also have a pre-vocational and vocational training program. We call it work in the farm or work in the field. It operates as a protected training space in employment skills for people with severe psychosocial problems who receive our services in the wider areas. Its main aim is social integration through therapy and vocational training. We use the permanent cultivation, this method, and we chose farming as a subject because for two reasons, both because working with the land has proved to have therapeutic effects on people, and also because the majority of users of our services come from farming families. Last year, 20 members were educated or worked there. You can see some beautiful pictures from the work in the field. In 3 municipalities of Athens, we have a day center for people with psychosocial problems. It's, of course, our services are free of charge for adults with psychosocial problems. The service of the center includes psychiatric assessment, psychological support and psychotherapy, social welfare support and counseling for carers of people with mental illness, psychotherapeutic groups and psychological support groups, and socialization programs. Last year, 375 people used this service. In Athens, we also run a program for people that have been diagnosed with cancer. It's the day center for the psychological support of patients with cancer. It offers a wide range of free services for patients and their families: psychological support, psychiatric follow-up, personal and family consultation, personal and group psychotherapy, and also teaching of relaxation techniques like dance therapy, and taking care of social issues. 469 people used this service last year. In Amphissa, which is the capital of Phokida, this mountainous area, couple of hours or 3 away from Athens, I think, there is a day center for children, adolescents, and adults. with a variety of difficulties, as well as psychiatric diagnosis. It offers evaluation and needs assessment services and creates and applies individual care plans, including both personal and group therapeutic programs, and maintains regular contact with the user's social framework. That is their family, if their kids' school they attend, working environment. In addition, it deals with the design and application of prevention and mental health promotion programs, the so-called community sensitization for us. Last year, 161 people used this service. You can see some nice pictures from sports activities of this service and from other kinds of activities. Now, another big part of our work is the so-called community sensitization activities. Is the work done, I have it quoted because these are the actual words of our professor, of our establisher, is work done with the population in order to change attitudes towards mental health. So we systematically work with the local communities in order to raise awareness on mental health issues, to promote the social inclusion of people with severe psychosocial problems, and to combat stigma. Last year, 635 community education actions were carried out. Some of them with schools and local bodies, actions in the field of art and culture, actions to protect people diagnosed, and also in collaboration with local bodies. A big part of these actions were done with students, teachers, and parents of students as part of a program that was called Living and Learning Together, Sensitization, Prevention, and Enhancement of Psychological Resilience in School Communities. It was a program that was implemented in the 4 prefectures we work at, with the approval of the Ministry of Education and the Institute of Educational Policy. So we had the opportunity to work with 78 school units, with thousands of students, hundreds of teachers, and hundreds of parents, and it went really well. Actually, it participated as a good practice in Mental Health Europe's online event that was called European Capacity Building. It was held in November of 22. Here are some pictures from our interventions at schools. And with local bodies in the community. Of course, we find it of viral importance that we have to be part of networks. That is why we exchange our experience and knowledge acquired through the provision of mental health services with other partners, both in Greece and in abroad. The aim of these collaborations is to encourage and promote Greece's ongoing psychiatric reform and protect the rights of our users. It's a founding member and participates at the boards of important mental health organizations and networks in Greece and in Europe. I should mention here probably that Ms. Athina Fragouli was on the board of CEFEC, the Organization of Social Firms Europe, of Asklepios. We're also a member of Mental Health Europe, EUCOMS, of course, the European Disability Forum. A quick word about the fact that we run as many Erasmus Plus European programs as we can. Here are some of them. You see, last year we networked with 45 organizations from 15 countries and with 35 agencies at the local and national level. I'm not going to read them. These are some examples of Erasmus Plus programs we worked on. Okay, if anyone wants to Google us and read more about us, you can click www.EUCOMS. And that's all from me.
Well, thank you very much, Eleftheria, and to the audience. Please put your questions in the Q&A. But before we go on to the next speaker, I would like also the floor to Theonas, because we wanted him to open with the lived experiences. So he's not only a singer and a guitar player, but also a speaker. So we would like to have the word from you, Theonas, to give introduction from your perspective. Thank you.
Hello to everyone. My name is Haratsis Theonas, and I'm going to read a text I've written with the help here with the help of Alexandros Tudor's help. We are housemates. We live in the same house. Okay, now I will read. I have been living in a protected apartment of the Society of Social Psychiatry, Panagiotis Sakellaropoulos, for about 14 years. Those years marked the improvement of my mental health and, generally speaking, my evolution as a human being. I consider that without my therapist's support, I couldn't have managed all these things I have achieved until now. 2 years have passed since I have started working as secretary assistant in the social enterprise Kispe Diadromes. I am also a member of the board of directors of that social firm. Those professional activities helped me to have a better comprehension of what responsibility, service, and reward mean. To reach that level of functionality, I had to go through many stages. The most important of them were to look after and love myself, to take my medication, to have a daily timetable, and to communicate as well as I can with other people. Additionally, another factor that helped me a lot was the day center, where we took part in various activities, ranging from poetry to board games, in which I still participate. There, among people with mental health problems like me, I learned the benefits of mutual support among peers. Even though I feel the future years will be the most fruitful in my life, I don't rest my laurels because I believe that I still have further potential of development. I have attended a plethora of seminars and conferences in which I gained knowledge and experience which I can use in the future. I would like to close my presentation by touching upon a subject which consists in the fact there is an omission given that in protected flats people from the general public aren't admitted. In the Greek health system, someone has first to be treated in a hospital or a hostel, and then the person can go to a protected flat where the treatment will continue. The result of all of this policy is that people who need mental health care are excluded from the benefits of the state in a unit with a limited number of tenants, which will provide them the tailor-made treatment that they need. All this I said, having in mind my mother, who enters in and exits from hospitals, a problem which we, her children, haven't found a solution. I hope that soon the Hellenic government will find an appropriate solution to this problem. This is what I want to say.
Bravo.
Thank you. Thank you.
Thank you, Theonas. Thank you. Thank
Thank
you very much. Okay, you should have spoken before me. There's a slight change in the role, but it's okay, I guess.
It's okay.
Very interesting, your view of things. Yeah. So I'm gonna introduce you to Miss Iliana Lazogeorgiou, a colleague of ours. She's a psychologist that works in Amphissa in the prefecture of Phokida, and she's gonna talk to you about the mobile mental health units.
Good afternoon to all. Thank you very In my today's presentation, I will try to explain, describe the main functions, the structure, and the main goals of the two old since the 1980s. Next. The Mobile Mental Health Unit in Phokida and the Mobile Mental Health Unit in Thras were established in the early 1980s and are operated by the Society of Social Psychiatry. Our founder was Patrioti Sakellaropoulos, a psychiatrist, psychoanalyst, a professor of psychiatry at the University of Thras. Both mental health units are funded entirely by the Greek state. In addition to that, the provision of their therapeutic services is being monitored on a monthly basis by the Greek state. Both of the mental health units have been operating according to the basic principles of social and community psychiatry, following the psychiatric reform in Europe. Goals and factions, yet there are differences stemming from socio-cultural elements of the different regions. The units resemble the community mental health models in Europe, such as in UK, in the FACT model in the Netherlands, and the assertive community treatment in US and other countries. Next. As we can see in the map, the Phokida prefecture is situated in middle central Greece. It has an estimated population of 40,343 inhabitants. It is a rural area, mostly mountainous, with many small and remote towns and villages. Access to capital cities and large urban centers like Athens is relatively difficult. Amphissa is the capital city of the Phokida prefecture, where is the basis of the mental health unit of Phokida. The unit delivers services in 11 towns and villages of its catchment area that you can see with the green dots all over the map. The mental health unit in Phokida is the only mental health service provider available in the whole region. As a result, it takes responsibility to meet the mental health needs for the majority of the population in this rural region. Next. The mental health unit in Thras covers a rather big area, as you can see in the map. It covers the regional units of Evros with a population of 133,000 inhabitants, and Rhodope, which has an estimated population of 104,000 inhabitants. The mental health unit delivers services in 6 geographical areas of the Thras prefecture, as you can see on the upper north in the map and on your right hand. The capital of the Thras prefecture is Alexandroupolis, which has an estimated population of 71,000 people, and it is the basis of the mobile mental health unit. In the city of Alexandroupolis, there are various mental health services and facilities which are integrated in the healthcare system of the Thras prefecture. Next, please. Both mental health units are multidisciplinary teams. It means that we consist of several specialties, such as adult and child psychiatrists, adult and child psychologists, language therapists and speech therapists. We have social workers, psychiatric nurses, prime-time teachers, and administrative staff. For the year 2023, the mobile mental health, the team in Phokida consisted of a total of 21 people, as the unit in Thras for 2023 consisted of 21 people. The clinical teams in both units meet weekly in order to share information on clinical work, to evaluate treatment plans, to evaluate treatment paths, to report on clinical cases, and to coordinate several community activities. It is important to mention that the clinical teams are undergoing continuous supervision by expertise in the area of mental health. Next, please. The main goals of the mobile mental health units are to provide accessible mental health services to all people in need, prevention and promotion of mental health in the general population, psychiatric, psychological care of people with mild and severe mental health problems who are at risk of homelessness, psychiatric crisis, and hospitalization. Early diagnosis and treatment, prompt intervention in children, adults, and families who suffer from mental health problems. Prompt intervention in the first episode of psychosis and in psychosis relapses. Stabilization of people with psychosis, continuity of care, elimination of crisis episodes, exclusion of hospitalization, psychosocial support and work rehabilitation, sensitization and education of people about mental health units issues. Thank you. Our services, our main services that are being we provide is the psychiatric health problems, children and adult psychotherapy, psychosocial rehabilitation, speech therapy, work with community and building social networks. Thank you. Next. Thank you. Although both mobile mental health units provide treatment for most mental health disorders, the focus is on long-term mental health illness, especially on psychotic and severe mood disorders. Referrals are made by the public healthcare system and the local authorities, such as law enforcement and social service agencies. Moreover, referrals are also made by the family and the caregivers, as well as the people by themselves. In the prefecture of Thrace, referrals are also made by the psychiatric department of the university. If we can take a look at the statistics of the mobile mental health units for the period of January till November of the year 2023, we can see that the mobile unit in Phokida provided services to a total of 649 people, and the mobile unit in Thrace provided services to 1,111 people. We can see that according to the sex, more females than male received services from the mobile units. Following to the age category, we can see that in the mobile mental health unit of Phokida, most people are in the ages between 50 and 64 years of age, following by people who are in the ages of 35 to 49, and to 65 and over. In the mobile mental health unit of Thrace, similarly, we can see that the most people fall in the category of the ages between 50 and 64, following by the ages of 35 until 49, and then for people 65 and over. Please change. Okay. As regarding the diagnosis in the mobile mental health of Phokida, using the diagnostic tool of ICD-10, we can see that more people in the purple pie, we can see that more people fall in the category of neurotic stress-related disorders, following by people who have mood disorders, and then by people who have schizophrenia. Next. According to the diagnosis in the mental health unit of THAS, we can see that most people fall in the category of mood disorders, following the category of schizophrenia and delusional disorders, and then by the biggest proportion is in the neurotic stress-related disorders. Thank you. Next. One important function of the mobile units is the continuity of care. Continuity of rather dimensional concept that has been associated with positive clinical and social functioning in severe mental illness. In a recent qualitative study conducted in Norway, it has found that there are 5 dimensions of continuity of care. One of the most important dimensions was the feeling of safeness in an ongoing personal relationship. People valued a trusting relationship with the same mental health professional or a team of mental health professionals over time. Frequent breaks with therapists and having to relate to new ones elicited anxiety, feelings of rejection, and frustration. Another important dimension was timeliness. That is, people feel relief when they do not have to wait too long to get help for their problem. Another dimension is mutuality, which is the people have the need for reliable professionals who take the initiative to contact them first and even between the scheduled appointments. Another dimension was choice. The person would like to be able to make choices about treatment place or treatment type. Needs to be informed about decisions and their consequences in order to feel safe. To achieve the goal of continuity of relatively stable composition. Psychologist or a nurse or a language therapist. For therapeutic reasons, effort structure of each subgroup stable over time. The stable composition of the subgroup plays a key role to the establishing of a long clinical team and health care. Another important function of to people with psychosis and to their family. The follow-up sessions include psychological support, psychiatric care, family support, psychosocial rehabilitation, vocational training. In a typical session, the therapist evaluates the person's mental state and treatment adherence. The person is allowed to discuss their general mental health concerns and concerns about their medication with the therapist. The therapist uses positive reinforcement to improve the person's treatment adherence. Furthermore, the team aims to increase the motivation of the person to participate in social activities and implements educational programs to improve persons' social skills and strengthen the integration into the community. Finally, the clinical team supports people to better manage their needs while living in the community. The basic element to achieve this work is to build a trusting. Thank you. Next. Use avoidable hospital and relapses in people with severe intervention in professional expertise, team working skills, active listening, and although there are guidelines for good clinical practice, crisis interventions often require some Okay. The crisis intervention takes place within. During the crisis period, the team visits the person daily until their symptoms subside and the person feels safe or at least less overwhelmed. The family is also supported and encouraged to get involved into the crisis management process. Work with the community is prioritized so the person and their family feeling accepted and supported by the community. The aim of the crisis intervention is to alleviate or reduce the psychotic status of the person. The team actively listens in order to build trust in the relationship. When that has been established, the team emphasizes the need to adhere to a therapeutic treatment. The team supports the family and works with them to alter any negative attitudes, feelings, and help them cope with negative feelings like guilt and anger. Although the goal of the unit is to deal with the crisis within the community, sometimes hospital admission is unavoidable, and in fact, it may be beneficial to the person. In such cases, people in the Phokida prefecture are referred to the psychiatric units of general hospitals nearby, like Athens or other large urban centers. Similarly, in the Thras unit, the people are referred to the psychiatric unit of the University Hospital of Alexandroupolis. During hospitalization, members of the team maintain regular visits to the psychiatric unit and collaborate with the medical staff until the person is discharged and returns home. Maintaining contact during hospitalization further strengthens the therapeutic relationship, enhances treatment adherence, and results in relapse prevention in the long term. Since the mobile unit in Phokida is the only available mental health service provider, it has implemented a standby on-call procedure during the weekends for emergency situations. Emergency situations mostly refer to people with severe mental health disorders who face a relapse. The therapists involved in the standby procedure are experienced and well-trained psychologists from the team, nurses, social workers, and psychiatrists. Next, please. Lastly, another important function is working with the community. The basic aim is to inform and sensitize the local community about mental health issues in order to reduce mental health stigma and to change negative attitudes towards people with mental health disorders. The mental health unit provides a wide variety of activities such as seminars, public speeches, tutorials, social forums, articles in public press, the radio, and the television. Implementation of mental health promotion programs is more effective when it is organized in collaboration with local authorities and local institutions. In small communities, the team keeps in contact with local key figures, such as the mayor, the local elected council, the district attorney, the police authorities, the local pharmacists, primary healthcare doctors, and the clergy. Furthermore, the mental health units develop education programs targeting specific groups in the local community. Medical doctors, nursing staff in the hospital, police authorities, school teachers, social. Effort is given on the development of social institutions in order to enhance a more holistic approach and attention to people's needs. When we are in the communities, we are trying to get people to know and connect to the work that has been done. We are trying to gain commitment of groups. We are towards mental health issues by giving paradigms of positive behaviors, conceptions around mental health issues. Finally, in the prevention area, focus is given on working with students, teachers, and specifically, we develop interventions within the classroom seminars to teachers on the whole effort to bring communication channels their needs. To conclude, I would like to say that the mobile units in Phokida and in Thrace are two community-based services that cover as effectively the mental health needs of the population in these regional areas of Greece. Their work should be viewed in a context of an inadequate existing Greek psychiatric reform, characterized by the lack of formulation of mental health legislation, the lack of funding for mental health services, the scarcity of primary mental. Despite the difficulties, the mental health units for over 40 years continuously provide high-quality services, ideologically driven by a humanistic approach, and always inspired by the basic principles of our founder, Sakellaropoulos, whom always emphasized the building of a trusting relationship between people and their communities. Thank you very much.
Thank you, Iliana. You had a small problem with your microphone, I guess. It was going on and off.
Yes, it
Okay.
was hard.
Hopefully, people got your message. So we shouldn't spend time. We go on with the third presentation from our colleague Ioanna Kalia. She's a mental health worker also in Amphissa. And so we'll talk to you about the interventions that took place in Northern Evia during big, unfortunately, big bushfires we had there, and the role of the mobile mental health units that played there. Ioanna?
Good afternoon. I'm very glad to be here. Is my presentation okay? Okay. So today I will present you a remarkable journey of compassion, collaboration, and unwavering support, an intervention that transcended mere assistance to embody a profound commitment to mental health and well-being. In times of environmental crisis, the resilience of communities is put into the ultimate test. When Northern Evia faced the burden of such adversity, it wasn't just about rebuilding structures. It was about healing the hearts and minds of those affected. As we delve into the initial days of the intervention, we witnessed the swift response of dedicated mental health professionals, voluntary organizations, and compassionate volunteers. United in purpose, they converged upon Northern Evia, extending immediate aid to those grappling with the aftermath of the crisis. This concerted effort under the aegis of the Argo Federation and the Ministry of Health exemplified the power of collective action in times of dire need. Participation from 6 esteemed mental health organizations marked a pivotal moment in our intervention. These agencies, acting as the vanguards of support, lent their expertise to the regions of Northern Evia, laying the groundwork for comprehensive mental health assistance. Our intervention thrived on the strength of multidisciplinary teams, comprising psychologists, social workers, and other mental health professionals. These teams fostered collaboration and knowledge exchange. Networking with local government bodies, agencies, and community leaders bolstered our collective efforts, enabling to forge meaningful connections and address emerging needs effectively. The establishment of local first aid stations and mental health service provision served as lifelines for distressed communities. These stations not only dispensed essential aid, but also provided a haven for individuals to seek solace and support. Primary needs mapping facilitate a targeted response, enabling us to identify and prioritize critical requirements such as food, medicine, and shelter. At the core of our intervention lay a commitment to empathy and understanding. Training activities, including mental health first aid and workshops on the psychological effects of natural disasters, equipped all volunteers and professionals with the requisite skills and sensitivity to navigate complex emotional landscapes. Our intervention in Northern Navia was marked by meticulous planning and compassionate action. We embarked on a comprehensive approach aimed at addressing immediate needs and fostering long-term resilience within the community. Care delivered door to door served as a lifeline for individuals grappling with the aftermath of the crisis. Through these intimate interactions, we not only provided mental health first aid, but also embarked on a journey of empathy and understanding. Primary needs mapping allowed us to tailor our response to the specific requirements of each household, ensuring that no voice went unheard and no need went unanswered. Our intervention thrived on collaboration and partnership. Interface with other organizations enabled us to pool resources and expertise, ensuring a holistic response to the crisis. By forging meaningful connections with local authorities, agencies, and community leaders, we laid the foundation for sustained support and empowerment. The provision of psychological and psychosocial support lay at the heart of our intervention. Through a myriad of initiatives, including group activities and individual counseling sessions, we sought to provide relief and care for both direct and indirect victims of the crisis. Our goal was not only to heal wounds, but also to empower individuals to draw strength from within, fostering a sense of resilience and hope amidst adversity. With the introduction of mobile mental health units, we ushered in a new era of support and care for the residents of Northern Navia. These units, staffed by dedicated professionals, offered a lifeline to those in need, ensuring that no individual was left behind in the journey towards healing and recovery. By providing ongoing support and intervention, we sought to instill a sense of optimism and renewal within the community. Mental health teams' catchment areas in Northern Navia refer to specific geographical regions or territories within Northern Navia where mental health services are provided and coordinated. These areas are strategically designed to ensure that individuals and communities affected by the crisis have access to timely and comprehensive psychological support. Key aspects of mental health teams' catchment areas include geographical scope. That means the catchment areas are delineated based on geographical considerations, taking into account factors such as population density, accessibility, and the distribution of affected communities across Northern Navia. Secondly, service delivery. Within each catchment area, mental health teams operate to deliver a range of mental health and psychosocial support services. These services may include counseling, therapy, crisis intervention, psychoeducation, and referrals to specialized care when needed. Thirdly, staffing and expertise. The teams comprise mental health professionals with diverse skill sets and expertise, including psychologists, psychiatrists, social workers, and counselors. Also, community engagement, that mental health teams actively engage with local communities within their catchment areas to foster trust and cultural sensitivity. They collaborate with community leaders, organizations, and stakeholders to understand community dynamics, identify needs, and develop target interventions that resonate with the local context. Coordination among mental health teams operating in different catchment areas is crucial to ensure seamless service delivery, resource optimization, and continuity of care. Teams may collaborate with other healthcare providers, emergency responders, government agencies, and non-governmental organizations to leverage existing resources and enhance the overall response effort. Continuous monitoring and evaluation of mental health teams' activities within catchment areas are essential to assess the effectiveness of interventions, identify emerging needs or gaps in service delivery, and adapt strategies accordingly. Overall, mental health teams' catchment areas serve as operational frameworks that facilitate the provision of mental health services in a structured, systematic, and community-centered manner. By establishing these designated areas, the intervention can reach individuals and communities most in need and contribute to the broader goals of healing, recovery, and resilience building in orphan areas. The numbers associated with the intervention provide valuable insights into the scale of the operation, the challenges faced, and the impact achieved. So the key numbers are the duration of the intervention, that was 3 months, highlighting the sustained effort and commitment of all involved parties over the extended period. The staff members, it was 116 total. That reflects the significant workforce mobilized to provide psychosocial support to the fire-affected areas of Northern Area. 2,738 people received psychosocial support, which quantifies the direct impact of the intervention on individuals and families grappling with the aftermath of the crisis. 45 people not previously mapped, about 100 people unemployed and in need of social support, draws attention to the socioeconomic impacts of the crisis, and about 800 people in the age of 60s who needed further support from services. Also, the psychoeducational actions for 387 children and 104 parents emphasizes the proactive measures taken to address the specific mental health needs of children and families impacted by the crisis, including preventive interventions and educational initiatives. These numbers collectively provide a quantitative snapshot of the intervention's reach, effectiveness, and the areas for further attention and improvement. They underscore the multi-phased nature of crisis response and the comprehensive approach required to address the diverse needs of individuals and communities affected by environmental crisis. Finally, it's very important to say that the most heard phrase in this time in Northern Area was from individuals, "Don't forget us." And it's very important to say that in the next year, residents of Northern Area witnessed the inception of mobile health units, a testament to our enduring commitment to their well-being. These units equipped equipped with dedicated professionals and guided by compassion, served as pillars of support for children and adults alike. With the 8 permanent, so there were 8 permanent levels of psychosocial support, and they held a new era of resilience and renewal for the community. As we conclude our journey through the intervention, we can see in some photos. So our journey through the intervention of Northern India, we are reminding of the indomitable spirit of resilience of the human heart. Our intervention may have begun as a response to an environmental crisis, but it was blossomed into a testament to the power of community, compassion, and collaboration. Through the road ahead may be fought with challenges, we draw strength from the bonds forged and the lives touched during the time in Northern India. Our intervention may have come to an end, but its impact will resonate for years to come. And I must say that central to our intervention was the empowerment of communities by engaging with local leaders, organizations, residents. We empowered them to take ownership of their recovery journey. Moving forward, it's essential that we continue to amplify the voices of those most affected, ensuring that their needs and aspirations remain at the forefront of our efforts. Concluding, our intervention journey has been one of the continuous learning and adaptation. As we navigate the complexities of recovery, we must remain open to new ideas, perspectives, and approaches. By embracing innovation and flexibility, we can better address the evolving needs of Northern India and chart a course towards sustainable recovery. Thank you very much.
Thank you, Ioanna. Very interesting presentation. I think we're a little bit out of time, so maybe Theonas, you could play just one song for us, just to
okay.
devote one song
We
and
are
then
going
go
to
to
play
the
one
Q&A.
song.
Yeah.
Okay.
So we
This
should
song,
remind everyone to write their questions at the Q&A button if there are any, and after Theonas' song, we could answer them. Okay.
okay. This song is from Israel. Okay.
Shalom Haverim, Shalom Haverim, Shalom, Shalom, Lehitraot, Lehitraot, Shalom, Shalom, Shalom Haverim, Shalom Haverim, Shalom, Shalom, Lehitraot, Lehitraot, Shalom, Shalom.
Thank you very much.
Thank you.
Thank you very, very much. That was beautiful. I can see that we have some questions or some comments in the Q&A button. So, a lot of questions from Godfrey Kagayani, if I pronounce it correctly. I'm not sure. What is the prevalence of mental health conditions in Greece and the treatment gap? Okay, the prevalence of mental health conditions, to my knowledge, in Greece is about the same as it is worldwide. If someone has anything else to say about it from my colleagues, I think about the, I mean, it's around, I think around 1% for severe mental health problems like schizophrenia, and I think I've read that it's about 15% in general with any kind of mental health issues after, especially after COVID-19 situation. Secondly, what is the healthcare budget allocation to mental health services? Okay, there is an annual budget of $48 million euro, sorry, 48 million euros, but apart from hospitals and their services, that is anything that has to do with hospitalization of people with severe mental health problems, or mobile mental health problems, mobile mental health units that hospitals run. These are outside of this budget. And that there is also a separate budget, annual budget of 30 million euros for the area of substance abuse services. Okay. Now, he also asks, we also know that governments, especially from LMIC, have not yet prioritized investments in community mental health services. Is it the same case with Greece? Yeah, well, maybe our president, Mrs. Frangouli, would like to talk a bit about it. It's a constant fight towards this goal, this prioritization in community mental health services. No, we can't say that they're prioritized. It's still an issue. What do you think, Athena, about this? What's the answer? Is it prioritized?
They are trying. I mean, the state is trying to make better services and to meet people's needs. They put effort on the people with dementia, people with disabilities. We do have a low percentage, though, of services covering the needs of children and adolescents. So we put the main issue of our pressure in order to improve and to have more services around the Greece, around Greece, to have more services for children and adolescents.
Another question is, how do you ensure perspectives of those affected by mental health conditions are fully integrated into your work and programming? Okay, I have to say that we always work separately with each one of the people we work with. I mean, there is an individual therapeutic plan for everyone, if that's the question, because I said at the beginning that we work with a psychoanalytic prism that follows the principles of working one-to-one, like taking into consideration the personal needs and the individual needs of all aspects of the user's life. If That was the question. I'm not sure. And also, if the question has to do with people with mental health issues in general, we have to say that we have a close collaboration with organizations that people affected by mental health conditions are members in, or they're like users of services have their organizations. So we work hand in hand with these organizations, and anytime we have to work towards their goals, we are their advocates. And there is there is another question for Ileana. If it is planned to include peer workers, and we also have, after you answer this question, Ileana, maybe we should give the opportunity to Camille Rain to say hi, because he would like to do that. He's a peer consultant. Okay.
About peer working, I could say that it is in the concept of our work from the first beginning. Although we don't actually have experienced peer workers, and we don't actually have in Greece a system started, organized about the education and of peer working, and but mainly I would like to say that it is in the concept of our work.
There is another question for the mobile mental health unit section, I think, Ileana. Can you see it from Fabiana?
It's
Fabiana
about no, it's about the specific outcomes that was stated in the presentation of Ioanna.
Okay.
And so you could
about what's evaluated. Ioanna?
What is evaluated about the teams? I can't understand exactly. I'm not sure that I understand the question.
Maybe we should give the opportunity to Fabiana to ask it orally.
Maybe Fabiana can come into the meeting.
Yes.
Can you raise it? Yes. You're here for us. Yes.
Hello. Good evening. Καλησπέρα. Τι κάνετε? I had a question about your presentation. I hope you can hear me. You stated that you are continuously monitoring and doing an evaluation, and I was very interested what kind of outcomes you're evaluating or process. Is my question more clear?
About the team process.
Yeah, you had one bullet point about monitoring and evaluation, and then you told you were constantly monitoring. So that's why my question of what are you exactly monitoring in your teams?
Maybe Mrs. Fragouli can help me with that question if she wants. Because the monitoring of teams and multidisciplinary teams was from Κυρία Φραγκουλή, βοηθήστε με, δεν μπορώ να το πω, ότι κάπως ότι υπήρχε ο συντονισμός από εσάς, από το EAC.
Ναι, για να απαντήσουμε τι, Ιωάννα.
Αυτό το κομμάτι που λένε με το πώς αξιολογούσαμε την πορεία των ομάδων. Με τον συντονισμό που γινόταν κάθε Δευτέρα ή το staff care που κάνατε.
Και παρακολούθηση. Okay, so it's the monitoring process that we use. We do have the meetings, group meetings, staff meetings. We do have regular users meetings, and with specific questions, and having the statistical as well figures. We have the evaluation of the results. One of the tools that we are using is also the SWOT analysis, if that gives you an answer. There are questionnaires that we do give to our user services every year. And so we see the results, we see the proposals that are made, and accordingly, together with the staff, together with the people that are living in the residential houses, we see how with the method of co-production and the method of co-designing, see whatever really can advance the living conditions. We try to do the same sometimes with the families as well. Also with the schoolwork that we are doing, working together with the teachers, and see the elements that are coming up, how we could use it in the sensitization process of the community to make it as a tool in order to make proposals either to the local key persons, to the local governments, and of course, from time to time to propose to the state ways that they can better the conditions. There are difficulties to ameliorate the budget. So that's why we try, the people, especially the people who are working the mobile units, to make it the staff to be much more connected really with the local peoples, with local hospitals, doctors, and try to find ways in order to make the conditions a little bit better. I'm not sure that we are answering to specifically to the question, but we are ready to make it more clear if there is more specific question.
Yeah, I'd like to also maybe to jump in here, also because of the time, because I would like really to connect you to Fabiana, who asked the question. As you heard from her introduction, she's from Greek origin, so she speaks your language even, and she's head of our research department. So for our connection, I would like to connect you to each other, and because of the time, because we want the final word to give again to Theonas. We can't answer all the questions, but we will answer them then later in the on our website, the questions that are not answered yet. But I want to thank all the speakers very much, and thank you, Eleftheria, for chairing this wonderful evening. Been several times to Greece, to the Society of Social Psychiatry in Athens, and recently also in Delphi, and always impressed by your work and also by the way that you pick up relevant themes of the present, like now with the fires, and also when there was the large group of refugees, you picked up that also. You're always ready to be there for people who need your care. So what I would like to show now, before I give the word to Theonas, is the upcoming meetings of EUCOMS in this year 2024. Here they are. So we have an on-location meeting in March, 14 and 15 March, in Cologne in Germany. And you're very welcome to join. That meeting is very interesting because there the social psychiatry is really part of the municipality in Cologne. And then we have several other webinars planned as well. March 27 with the World Health Organization, the mental health flagship. And in September, we will have, together with the Slovakia Mental Health League, a session on LGBTQ+, and the connection with mental health. Then we have an on location meeting again in October in Lisbon in Portugal about sustainability of care. And in November, we have a webinar on peer support in prisons. So many interesting topics. So save those days in your agenda. And if you think what happens in Greece is really interesting, next year, 25, we will have an on location meeting. The date is yet to be determined exactly, but will be some point in spring. So keep that in mind that we can also meet these interesting people in Greece. Having said that, I thank you all, and I want to give the final word, as we always do, to the person with lived experience among us. So please, Theonas, give your reflection on this evening. Thank you.
Okay. Thank you very much to listening to us. I would like to close this webinar by saying that I am very happy. I live in a protected apartment of the Society of Social Psychiatry because they treat me very well, me and all the other people. And I would like to say that when my therapist told me to participate to this webinar and play music, I was anxious, a little bit anxious, because when I play music for myself, it's different, and before an audience, it's something else. But I think Alexandros and me, we did it quite well. So I would like to close this webinar by reading to you a poem I've written before 3 or 4 years, and it is about what liberty means to me, what liberty is for me. Liberty. Liberty for me is the smell of a recently printed book, the human relationships in all of their dimensions, the complexity of this world, but also its phenomenal simplicity. Liberty is when I have the courage to choose without feeling guilty, without feeling inferior, without feeling ashamed. Liberty is a ladder I climb step by step, a road I walk step by step, a bridge I cross over a river. Liberty is the vast starry sky, the deep blue sea, the infinite, endless universe. Liberty for me is to live, to love, to share, truly and fearlessly. Thank you very much.
Bravo, Theona.
Ευχαριστώ.
Bravo, Theona. Wonderful. Very beautiful. Thank you, René. Thanks a million for this opportunity and for all
very much.
works. Thanks everybody
Thank you.
for participating.
Thank you.
Thank you, and see you at the next.
Ovidiu, thanks for helping us organizing everything.
Yeah, pleasure.